Hello and welcome to Living with a Balanced Condition page. If you've just found me, thank you for doing so. I hope that you can hear me fairly clearly. It is, of course, Balance Awareness Week this week, which is certainly being promoted by the Many Years Society, who've also linked up with the American version, VIDA. Joining me today on the programme to answer any questions that you may have is Andrew Clements. Andrew is a balance physiotherapist, and he's also a trustee of the Many Years Society here in the UK. So if you've got any questions that are balance related that you would like to ask Andrew, then please feel free to do so. But before we get to questions, because we've probably already got a few, let's talk about Balance Awareness Week. What's the idea behind it?
Well, I think it's just to make people aware of how balance interferes. If there's a problem with balance, it interferes with everybody's life, daily life. We take it for granted, our balance, and if there's problems with it, it can range from being a nuisance to actually severely affecting your quality of life. And there are lots of problems that affect balance. So the Awareness Week has been running for quite a while. It's a set week each year, usually in September. And this year, as you say, the Many Years Society has been sponsoring it here. And VIDA, you mentioned, is the Vestibular Equilibrium Disorders Association, which is a website about all conditions to do with vestibular problems. They're involved with it in the States as well.
You talk about some of the impacts that balance conditions can actually have. Just how big an impact can some vestibular conditions actually have on people's lives?
Massive, and it depends on the problem, the underlying problem the person has, but it can completely ruin their life. The quality of life can be very limited, and one of the biggest problems I think a lot of people have is that people with balance problems can look normal, and therefore people think there's nothing wrong with them. You can't see a balance problem unless there's a really marked problem when they're walking. But when we talk balance problems, we're talking often inner ear or vestibular problems, and that can range from conditions like Meniere's disease, where you get severe attacks of vertigo, through to problems like BPPV, which is benign paroxysmal positional vertigo, which gives you positions when problems when you get into certain positions, such as lying down or rolling over in bed. Through to migraine type problems, because that can affect the vestibular system.
It's interesting that the Many Years Society say that 40% of people over 40 actually experience symptoms of dizziness and imbalance at some time or another.
That's correct, and we see, working here at it's the Leicester Royal Infirmary within the University Hospitals of Leicester, we have a balance clinic dedicated to looking at people with balance problems, trying to sort out what the cause is, and then trying to put them on a correct treatment path. And we see people from all ages, and we have as young as children up to people in their 80s and 90s. It's often thought that getting old means you have a balance problem, which is wrong. We get elderly people who've got balance problems, and our aim is to get them back to being close to normal for their age.
And what is normal?
Well, normal means not necessarily falling over, not bumping into things, not veering when you walk. So it does depend what the underlying problem is. And unfortunately, in the elderly person, there can be lots of overlapping problems. They might have visual problems, they might have vestibular problems, and they might have arthritic problems, and then have diabetes on top of it. So in that situation, you've got a combination of problems which overlap and will impact how good they can do. But if you get a relatively normal person in their 70s or 80s and they develop a vestibular problem, it can markedly affect their balance, but can be treated with relatively simple exercises.
So at what stage would somebody actually see someone like you?
But we need to have the diagnosis of the problem sorted out, because a diagnosis is quite important. If they've got, for example, uncontrolled Meniere's disease, so attacks of vertigo, which are very disabling, at that point it's no good seeing a physiotherapist until the attacks have been stabilised by whichever mechanism is being looked at, ranging from diet through to medication, or in some people injections in the into the ear. So people see physiotherapists or balance therapists when their vestibular problem has been stabilised, whether it's BPPV or Meniere's disease or even migraine. So then an exercise program can rebalance the vestibular mechanism.
We've had a few questions from a post that I posted a few
Yep.
days ago, Andrew, and you're quite happy to answer sort of general
questions
around balance. Because it's obviously quite difficult to talk about personal sort of individuals without actually knowing
identifying them. Yes,
absolutely, and knowing a great deal about them. Adele asked. She would love some input.
Not the Adele.
No, not the Adele, no.
Oh, okay.
Adele said she would love some input on what could cause one to fall backwards. Until recently, it was the left-hand side, but it's now changed. And Juliana also asked the same question. Me too, always backwards and to the left.
Okay. Well, normally if you've got an imbalance between the ears, because with normal vestibular problems, usually only one is affected. So you get an imbalance between the ears, and you do tend to be more off balance towards the side that isn't working properly. So we could say possibly the left side's not working properly. You would be more off balance to the left, and maybe walking down the street, you would veer to the left. But when you have a balance problem, your system tries to sort it out, and quite often you can change your position in space. And we see that a lot here, that people's centre of gravity changes, and we haven't got a lot of flexibility backwards. So if your centre of gravity just changes slightly and goes slightly too far back, you will feel off balance backwards. Whereas forwards, we're much better with coping with going off balance forwards. We can see, we can take a step, whereas backwards it's much more scary because we can't see. So, and then once you're aware of that, you become more rigid, and then you're more likely to go backwards. When you're rigid and possibly trying to avoid going to the left, you will go backwards.
Okay.
But that's the sort of thing we would look at here, and with some of the testing we do to see if a person has changed their centre of gravity position in space, and then we will try and work with them to correct that. Because anybody with their centre of gravity too far back will feel off balance backwards, and it doesn't necessarily mean they've got a balance problem. They've just altered their centre of gravity for some reason.
So, sort of exercises,
Yeah.
there are exercises
Yes.
that you would give people to go away and practice.
Absolutely, and it could be as simple as, for the example you've just given, and I'm not saying it's correct for the person who's written in, but I would make them aware if their centre of gravity is too far back, and I would make them, by making them stand in a corner, or closing their eyes and concentrating on their feet, feeling where their centre of gravity is. And then I would show them when it's too far back, and I would make them feel what it's like, and I would show them what too far forward is, and then they can use feedback to try and correct the position.
Okay, if you are tuning in, hopefully you can see us live and direct from the Leicester Royal Infirmary. I do understand that maybe one or two of you are having problems watching this, so hopefully you'll be able to watch it back. There's some people saying that they're not able to watch the broadcast, but we're going to continue regardless and see what happens. We talked a little bit about how it can truly affect people's lives, and many conditions, many of these sort of vestibular conditions don't actually have a cure either.
Well, yeah, because a cure is the wrong word, because once something's damaged the vestibular system, say a virus or something like that, the damage is done, and the damage is permanent. But the brain can retune or recalibrate the reflexes involved in that, which is what vestibular rehabilitation is about. And so for people who've got a stable problem that doesn't keep changing, that's the treatment plan. But a lot of vestibular problems change and fluctuate, and Meniere's disease is an example of that, as is migraine and BPPV. You get a fluctuation in the balance function, and that means a person can be relatively okay, and then suddenly they change. And it's the unpredictability of that creates problems for people who can be in a normal job, and then suddenly they have an episode where they've been vertiginous and off balance, even at work or before they come into work, and then they have problems. So it's the unpredictability of these problems creates problems for them.
Lena, thank you for joining us, and Lee as well. You seem to be okay watching this right now. Lena had, expressed a lot of concern, I think, very similar to anybody with a balance condition that can be quite debilitating and quite frustrating, especially because it's a condition that people can't see.
It is. That is the biggest problem. Anybody with their arm in a plaster, people can identify they've got a broken arm or there's a problem with that. But with a balance problem, when people are at their worst, they're usually at home and no one can see them. And when they do try and get out, they can often look drunk or look like they've had a drink, and which is disturbing itself. And so they have to walk very carefully down the street. And then it's a lot of inefficient muscle use trying to walk when you've got a balance problem, so you can feel incredibly tired. And on top of that, people don't understand the problem and also don't necessarily want to understand the problem because they don't like hearing about problems. So, and I think that's the problem when you have a problem that fluctuates, that people don't see, even on a good day, that tomorrow you might not be very good again. And it's unfortunately with the sort of, a lot of my patients have found the problems with the sort of the social services or the Department of Social Security, where they're looking for being assessed for disability in quotation marks, that they don't really want to understand balance problems, because if you can visit, you're often at your best, and if you can't visit, you're in trouble.
So how do you get over something like that? How do you? I guess is the point of awareness weeks like this is
making a whole range of the problems that are available.
Yeah.
You need to be diagnosed correctly because, for example, when I first became a trustee of the Meniere Society, and I would go to the meetings there, we're talking quite a long time ago now, quite often there were people there that didn't necessarily have Meniere's disease. They had one of the other balance problems. And so the treatments for Meniere's disease are completely different for treatments of, say, BPPV, benign paroxysmal positional vertigo. So you've got to have the right treatment program. So if you treat someone for Meniere's disease by giving them, for example, beta-histine, that isn't going to help BPPV. And the same way in migraine, if you've got a person who's got a vestibular problem which is mediated through migraines, that needs targeting. Otherwise, that won't improve and they'll continue to have problems.
If you've got a question for Andrew, we're going to be around for a few more minutes, maybe a bit longer. This entirely depends on you. If you've got a general balance question that you'd like to put to Andrew this morning during Balance Awareness Week, it's something that the Meniere Society are quite keen to highlight throughout the week. So there are lots of events and things going on. We'll tell you towards the end how you can find out more about the Meniere Society and those sorts of things. But if you've got a question, then please type them in the comment section now. Don't leave it until after, because Andrew won't be here to then answer those questions. We did actually have a question from Catherine, Andrew, and she says, if you've been told that you have bilateral vestibular loss, is there any hope? First, explain what that means.
Well, that most of the balance problems we see here are one-sided, that one ear has been damaged by whatever, whether it's Meniere's disease or a virus. So you've got an asymmetry between the ears is what creates the balance problem. When you have bilateral vestibular loss, I think you said there, something, and if it's the first thing that the person would have to find out is it a complete loss? Because the most challenging balance patients are people who have lost complete balance function in both ears, which is complete bilateral failure for whatever reason. And what that means is the balance organs on both sides aren't working. So that gives a very marked balance problem, but we do treat that here. And I've had people with complete loss. I've got them back driving, which sounds sort of that they wouldn't be possible. They still walk like they're very drunk, and because things move, their vision moves when they walk. They have oscillopsia, which means their eyes move every step they take. But with correct exercises over a long time, you can improve someone's quality of life a lot with complete vestibular failure. But complete vestibular failure is rare. So quite often we see people who've been labelled that, but in fact with the testing we do, we find there is some function in one or both of their ears, even if it's just a little bit. And that's positive because then there's something to work on. So even if people have got bilateral vestibular problems, exercises can help, and so we work with what they've got to improve their function. How
can a person go about living their life as they did if they have a balance condition, or does it depend on A, the type of condition, and B, how much work they've actually put into to try and be normal again?
Right, that's hard to answer for different conditions, but most balance problems can be improved through some form of treatment. If we use migraine as an example, the migraines have to be stopped. The triggers have to be looked at, and sometimes that can be very challenging for patients because it could be dietary in nature, it could be their lifestyle, it could be their sleep pattern, so that needs targeted, and that can be very hard. If it's something like Meniere's disease, there are treatments now available for if the Meniere's disease is very active and people are getting attacks and vertigo frequently, that needs stopping, and there are mechanisms for that. It might be as simple as changing their diet. It might be an injection through the eardrum into the ear, the middle ear, to actually infuse different drugs into the inner ear. So there are treatments around which can try and take the fluctuation away from the problem. Then balance exercises can work. But what we try and do is look at what's causing the problem, what problems it creates for them, and we try and target their specific problems, because when people have balance problems for a long time, they will develop habits or coping strategies, and sometimes those coping strategies prevent them getting better. And so for example, a very elderly person might use as a coping strategy, we call it wall walking. They might walk around the room using the furniture, and then say they haven't got a balance problem, but they're using the furniture to get from point A to point B. So we have to try and change that if we want to get them better. A younger person might, which is quite challenging to treat, become very dependent on their vision, and they get what's called visual preference or visual dominance. So because their brain can't trust the information from their vestibular system, it starts over emphasizing the information from their visual system, and then they get symptoms in visually challenging places like supermarkets or shops, or very challenging visual environments like cobblestones, or with blinds or striped shirts, can actually make them feel off balance. And then unless you're dealing with a professional who understands that, it can sound very well, it doesn't sound like a balance problem, it sounds like an anxiety problem. And then treating the anxiety doesn't fix the problem because they're overusing their vision to balance. So we have to try and highlight that, work on it, and we can help that.
Do let us know where you're watching from, who you are, and if you've got a question. A few more minutes?
Yes,
that's
fine.
You,
that's fine.
Somebody's asked, it's Bren actually. Bren asks, can you publish exercises, please? There are...
well, yes, there are lots of exercises.
I was going to say, is there sort of, one exercise fits all?
Well, there isn't, and that's the problem with it. But there are lots of exercises on the internet already, and a lot of my patients have done vestibular exercises off the internet. The Meniere Society has an exercise booklet, which by contacting the Meniere Society you can be given the booklet, which I was involved in putting some of the exercises together. So the bottom line is any exercise is good, but with a vestibular problem it will probably make you feel worse to begin with. That has to be controlled because you have to do the exercises for quite a while to retune the ears. And that's where it's difficult to give generic exercise for any problem. But most vestibular problems need some sort of gaze stability exercise where people have to focus on a target and move their head and keep their vision clear on the target. And that's because the inner ear controls the eye muscles automatically, which is something called the vestibular ocular reflex. That means the ears, the eyes and the brain are linked. And if the vestibular system isn't working properly, basically the eyes move wrong when a person moves, and that's what makes them feel off balance. So we have to retune that, and that's completely retunable with exercise, and the gaze stability exercises are some of the most important ones, where they have to, if you're watching me, look at a target, focus on it and do a small head movement, keeping their vision fixed on the target. And it looks easy when I do that, but my ears are in balance. I have had people vomit in my office trying that exercise, so I'm very careful with it. But people with vestibular problems will have a challenge with that. But if you've got other sort of problems involving the vestibular system, that may not be the right exercise at the right time. So it is important to speak to someone about it. But as a general rule, general exercise is important, but not fitness exercise, because that's too fast and too long. So that people do that too quickly. So if you've got a vestibular problem, say going for a long run, or going on a treadmill will probably make them feel worse, but for no benefit.
But you do encourage people to continue to get out.
Yes, keeping active and lots of stimulation is important, but walking's a good exercise. Getting out walking in different environments, taking note if there are environments you don't like, and then what I would do as a clinician would be to work out with them why they don't like that environment, because then we need to build something into the treatment that allows them to get used to that. But you won't all have access to someone to do that, so it needs to be keeping active is really important, because otherwise balance problems tend to make you not move and become withdrawn and stop going out and stop moving, and then any movement makes them worse. So treating balance problems is about working with a person to get them gradually building up in a controlled way their exercise tolerance.
When you say gradually, how long can this process take?
Oh, it can take, if I say months to years, we would hope with a simple inner ear problem, within 3 months we should see quite good improvement. But not many people have simple inner ear problems, because you're dealing with a person who's got stresses at work, who's got stresses at home. So factors like that impact how they feel. If they're not sleeping properly, the balance problems will get worse. If they're really stressed because of what, say, work's putting them under, it's much harder for the exercise program to work. So what we try and do is make people aware of all that and then work with them.
What can you say to employers, perhaps, that may be watching and
if they
watch
are
this back?
Yes, it's having some empathy with what the person is telling them, because when people return to work, a lot of people see me here and they're going back to work and they're expected to be back exactly as they were before, and that's really challenging. It's actually getting them back to work. The more control the person has over their own return to work is the most important factor, and some organisations don't give that. They won't have someone back till they're 100%. It's very hard to get someone 100% if their work is in an environment, even like a radio station. Until you're in that environment, there's no way you can mimic that at home. So it's actually a graded, phased return is the most important thing for anybody. And if they're seeing me, I try and help them with that by writing things for work, what they can and can't do. Not everyone will have access to that, unfortunately.
So that means that some people, will have to give up work?
Yes, some people do give up work, yes. Yes, they're forced to, or they decide to, because it is challenging.
Lee wants to know what's the most frequent cause of balance problems?
Well, see, balance problems, we're talking about the inner ear here, but a person who breaks their big toe will have a balance problem. But then people will understand that balance problem because they've got a broken big toe. Vestibular problems, people don't understand the vestibular system. It's hidden away underneath the brain. So, what was his question again?
Some of the frequent causes of...
Oh, the most frequent cause would be a virus affects the inner ear. So a virus affects this part of the vestibular mechanism. Is called vestibular neuronitis. It damages it. The person gets a severe vertigo attack. So for the first week to 2 weeks, they have severe vertigo. They get over that, but then if it doesn't fully compensate, meaning going back to normal in the next 4 to 8 weeks, when they're better, they're not right. And then that's when normally they'd be having some sort of rehab to try and force their system to get as good as possible. So the most common cause is a simple virus damaging the inner ear, which is supposed to get better on its own, because that's the principle that rehab works on. There's a mechanism built into this. It should retune itself. I obviously people where that hasn't happened. So something hasn't caused it to retune, and then we try and work with that so it can retune. But when you get fluctuating problems like Meniere's or migraine, it keeps being hit, and with Meniere's the damage keeps being done. So over time, there's continual damage.
There's so much to think about.
Oh, there's lots.
When
yes.
you have a balanced condition, we've talked about the effect it can have on your life in terms of work and going out, things like driving. We talked a little bit about the effect it can have on trying to claim the right benefits or getting people to believe you.
To believe, yeah.
The Meniere Society here in the UK have a great resource online, don't they?
They do have a great resource, and becoming a member, which is very, if I say very cheap, but I am biased because I'm involved with it, the access to the information they've got is amazing, and they can help with information about making contact with work. They can help with information about the problems, and maybe even directing people to centres within their area that have good records of looking at people either with Meniere's disease or balance problems. A few years ago it was just Meniere's disease, but now it's expanded to people with vestibular and balance problems because there's no support for them out there. So the Meniere Society does offer really good support. The people in the office are fantastic.
There are local groups as well.
There are local groups, yes, all around the country, yes. Yep. And in fact the AGM is coming up within the next few weeks. I'm one of the speakers. I'm speaking on balance, so I'm still in the process of preparing. It'll probably be like this what I'm giving now, but they're talking about balance to people at the Meniere's AGM in October.
So if you suffer from dizziness or a balance condition like Meniere's, like BPPV,
yep,
like vestibulopathy with visual preference. These are all words
yes,
that I've certainly come to know over the last 7 odd years. For me, it was something that started about 7 odd years ago originally. I spent lots of time in your office, chatting to you and crying about how bad it was and how I couldn't cope. But I was better. I was able to cope for quite a long time until it occurred again. So it is a condition that
it can recur because any damage to the system is permanent. So with what you've just described, we in the medical terms would call it decompensating. So something interferes in your life and then your brain becomes aware your ears are out of balance again. So decompensation can occur, but then it can be retuned again afterwards. So you can get these episodes where you can be good for a long time and it can come back.
And anyone suffering with sort of depression, anxiety as a result of a balance condition, your advice, get help?
Well, get help, yes. Definitely find out what sort of is in your area, what's available, because unfortunately balance symptoms make people feel depressed and anxious, and going out can be really scary. But if only the anxiety is treated and not the underlying reason why they're anxious, it doesn't get better. Sometimes the medications for anxiety and depression make balance symptoms or dizziness slightly worse, and if that's their primary problem, the dizziness, then those medications don't work. So it's actually working with the person and their medical staff, including their GPs, to find out, well, if we can improve their vestibular system, they might not need medication for anxiety because that will disappear. Not for everybody, obviously, but we've got to look at the primary cause, and that's like with the diagnosis.
So if you want to find out more, the Meniere Society, as I said, have an absolutely fantastic website.
Yes, and they might be able to help people in other areas of the UK, with support groups, because there's support groups all over the UK, and they're always looking for members or to make contact. But the Meniere Society is a very good support group for people with either balance problems or vestibular problems.
And if you want to find out more, I will put the details in the comments box underneath. And please make sure you share this video as well. There's loads of other things happening for Balance Awareness Week throughout the week. The best thing to do is to check out their website. It is menieres.org.uk. menieres.org.uk. In fact, Andrew can show you the front of the leaflet that is also available. Loads of information available on their website. And if you'd like to talk to somebody, you can also call them 01306 876 883. I will put that information in the comments box as well. Make sure you share this. Andrew, thank you very much for joining me on the programme.
Thank you.